That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Hey everybody, this is Real Health with Brandi and Amir. I am Dr. Amir Rashidian, a chiropractor, and this is Brandi Rashidian, my other half. And this is Real Health, where we teach you how to feel better, get stronger, live longer, and feel younger. So what we're going to do is go through some articles. There's a lot of headlines. We have a lot of articles, but I think we're going to spend a lot of time on the first one, first couple, because it's a deep subject.
It is a big topic, and I think especially coming out of what not just our country, but what our world has come out of over the past couple of years. I think this is a really poignant article. We have two articles based on the same, right? So we have two, different entities.
Two reports on the same data.
Yeah, and I think many have been pulling this NBC article because it is huge. The NBC article is called "You're Not God. Doctors and patient families say HCA hospitals push hospice care." Now, depending on what you may know about the medical world, or if you've had any family members that have been ill or have been put on hospice care or palliative care, this is going to really resonate with you. For those who thankfully have not had any major healthcare crises or have not had a family member, pay attention, pay close attention, because this is going to raise hopefully some questions in your mind that if, God forbid, you're ever in that situation, you ever get into that ring, so to speak, which is, something I hope you bring to the foreground, that analogy here in a little bit. But this is going to make you ask some questions, as it should.
Yeah, I always thought hospitals were a place where angels work, and
I still do.
Their desires are total respect to our healthcare providers.
Yes.
First line of defense. They do risk their lives, and their intentions are to help. But what we're reading here in this article is a bit disturbing. Like Brandi said, NBC first report on this, and then Fierce Healthcare is another publication that kind of analyzed two reports. One was by NBC, and the other is actually the one they reported on is called Service Employees International Union, SEIU, and they also did a study on the same data. So the title of this article is HCA Healthcare Accused of Pushing Patients Toward End-of-Life Care to Boost Performance Metrics. What they're saying is the executives make more money. The executives of HCA Healthcare make more money if death rate is lower. And so when they transfer a patient that's about to die out of the hospital into end-of-life care, that death doesn't count as one of their mortality rates. So their mortality rates go down, their bonuses go up, they make more money. Now, you may not know what HCA is. HCA Healthcare is the HCA stands for Hospital Corporation of America. It was started in 1968. I believe, if I'm correct, they own over 180 hospitals.
Worldwide.
Well,
U.S. and U.K.
186 just in the U.S. is when I looked, and then there's some in U.K. as well. $60 billion revenue and close to $6 billion of net profit, quite a bit. But they also have 2,000 sites of other healthcare offices around the world.
So it's a huge entity, folks.
Yeah, urgent cares, freestanding ERs, walk-in clinics, and so on.
So for the average person hearing that, right, we all know that businesses of any kind are like, one of the goals, right, is to turn a profit, because if you don't have a profit, you can't continue to operate. So as business owners in the healthcare industry, that is something that you have to watch, right? Because if we don't have patients and they don't come through the door and they don't pay their bill, then we can't operate. I can't pay the staff. I can't keep the lights on. I can't pay my lease. So I think sometimes we forget that large entities like that, hospitals, are in fact a business,
They are
just like
businesses.
insurance
They are
companies are a business.
for-profit businesses. Yeah.
So part of what, do you mind if I jump in? Because the NBC article, not that I hadn't already been jumping in, I realize that. The NBC article starts with just an unbelievable story about a mother and daughter, and the daughter had been, had gotten really, really sick with COVID and pneumonia. And so she had been at an HCA healthcare facility and at St. David's in North Austin. And so she had been very, very ill. They felt like they needed to put her on a ventilator and put her into a medically induced coma in order to have her, heal and repair. So, but the challenge comes in that on multiple occasions, they constantly came in and were asking her mom, encouraging her to put her on hospice or palliative care. Her mother on multiple occasions said, I'm not going to do that. I don't feel like I have the right to take someone else's life or to make that choice. So there was definitely a moral, ethical, stance that she was taking.
Sounds
and
like
it's her
they
daughter.
were pushing her.
Yeah.
They were.
Well, that's what she felt too. So let me read you this straight from the article. It said on one occasion, 6 or 7 doctors and nurses gathered around Perez's bed and said, we really feel it's within your best interests and your daughter's to let her go. So to me, that feels a little bit like I'm being pushed or bullied. Like if you've already had multiple conversations and this was all confirmed through NBC looking at all of Perez's chart notes. So this isn't just conjecture from, the patient's or the patient's mom's point of view. Like NBC validated everything that she said through all of the
Medical
notes.
records.
Yeah, all of her medical records. So she said that she did not feel like she had the authority to take anyone's life. And check this out. 1 month later, her daughter made a full recovery and walked out.
Oh my gosh.
So now I think it would be important also to maybe.
Gosh, that breaks my heart to think that, she could have died.
Yeah. She
I
could have.
what the word palliative care, it just means we'll just make her comfortable and let her die. That's what it means.
Now, there is another aspect to palliative care that I actually found. I read this. This was also in the article, and they said that palliative care differs slightly from hospice care because with palliative care, they can still receive treatments for symptoms along with those intended to cure their illness, while hospice care just focuses on comfort and quality of life. But the palliative coordinators at HCA, as soon as they come in, from what I read in the article, it seems like they begin pushing hospice care. So and why do they do that? That's the big question. Why would a hospital make such a big deal in pushing people into one of these two areas? And guess what, guys? I'm sad to say it all boils down to numbers. So HCA actually has an algorithm that they've created that they run the patient's information through, and they determine through this algorithm that was built on what their mortality rate is for that day.
Yeah.
And so that is what they're using.
And if their number is above a certain number, they say you have to go to hospice.
So why would a hospital do that? Well, because when somebody is put on hospice or palliative care, if they do pass, it does not go against the hospital numbers.
This article says the deaths that occur after transfer do not count among the inpatient mortality rates measured by care quality organizations and the Centers for Medicare and Medicaid Services, which uses such measures to determine reimbursement rates. Additionally, prompt transfers reduce length of stay metrics while opening up more hospital beds for additional inpatient and subsequently increase revenue.
It's just unbelievable.
How many of those people that got transferred might have recovered in a month if they stayed in the hospital?
Yeah. How many would have been like Perez? Now, certainly, probably not all of them, right? There probably are a number of those patients that legitimately should have been recommended for palliative or
Yeah.
hospice care, right? But how many weren't? And that's the
One of the
question.
doctors who works at HCA at one of the hospitals actually, what a lot of them chose to be anonymous. They didn't want to reveal their names, but this person did reveal his name. His name is Ghassan Tabel, medical doctor. He says sometimes it's reasonable to talk about comfort care, but usually it is done prematurely.
Mm.
What is very alarming to me is that they misled the patient's family about the prognosis, paint the worst case scenario, sometimes graphically, to convince the family to go to palliative care and withdrawal of care.
This particular article was based on interviews from 6 nurses, 27 doctors who currently practice at 16 of the HCA hospitals in 7 states, or at least did so previously. These hospitals pushed palliative and end-of-life care in pursuit of better performance metrics. Internal HCA hospital documents and texts between hospital staffers that were provided to NBC support all of these healthcare professional views. So it's not just the ramblings of disgruntled healthcare workers.
Yeah.
That's not what it is. Some of these workers still are in that system, which is a little bit scary to me too. So they're
Right.
going, hey, I'm here, I'm working, this is what's happening, and maybe they're staying on board because they're worried they won't have another job. Maybe they have, seniority, who knows? Maybe they're hoping they can make a change internally. I hope that's the case.
Those transfers rates in between 2017 and 2021 grew from 3.4% of the people hospitalized to 5.2%. And the latter number in 2021 is actually almost 40% above national average for 2021, which means 40% more transfers to hospice from HCA hospitals than other hospitals. 40%, that's a big number.
That's a huge number. 40%, that's darn near half.
In-hospital mortality rates at the HCA hospitals were lower for each analyzed year than the national average, the union wrote. While HCA percent of hospital transfers to hospice care where a patient died on the day of their transfer. So the day they transferred them, they died. And think about this. That very day that patient died, it was more than twice the national average in 2021.
Wow. And let's just say these articles do cite that this is a national trend, right? This is not just, or we'll say it's an industry-wide, not just national. It says an industry-wide increase, and in gaining in traction for a lot of organizations to do that.
Yep.
Now, let me be clear. It also states that most of these do not have the algorithm that HCA has. Okay, so, but it's still a trend that we need to watch because every single hospital, right, or we'll say majority of these hospitals are for profit. So
they are. And I get this. This is a union member said this. The data trends are especially concerning since HCA has been rapidly expanding in the hospice/home health space in recent years. So they're actually opening up hospice locations.
we've seen it.
So they're literally transferring those patients to their own organizations.
That then don't have to count the numbers.
Yeah, so they don't count the numbers in the hospitals, but they still make money off of that hospice care that they provide for the patient.
And let's also, I also want to point this out because we've only pointed this to numbers, but this also has to do with insurance reimbursement. Now, we know a lot about insurance. We were in insurance when we first opened our practice. I fought for patient benefits. I would be so flustered when a patient would come in. I would be told they would get one thing, and then the insurance company would say, oh, sorry, we decided not to go ahead and pay that. right? How many times do we see that? We got out of insurance so we didn't have to
Yeah.
pad our walls
Right.
when I was doing verifications or following up. So part of this also is that patients' reimbursements from insurance begin to wane.
Right.
And then, so putting them into hospice care or palliative care often opens up a separate
Right.
benefit.
It's like starting care on a new condition
Correct.
because this is what
It's a
I mean.
game.
I'm going to assume most of our audience they're not in the insurance game.
Right.
Literally, it's a game because doctors who take insurance, let's say chiropractors, because that's what I am, a lot of times they'll see someone for a certain number of visits. When the benefits run out, they change the diagnosis so they can start over.
Yeah.
Transferring these people is the same thing. But you're transferring to something else that you own. So you're still making the benefits. You're making the profit.
Well,
you're making the money.
And you're making more off that because now
Right.
you also have turned to bed very quickly.
Right.
And now you can plop somebody else in there and you can begin to get that new reimbursement from that new case.
Right.
So, and again, I get the business side. I get that you need to be operational. You need to pay your bills, right?
Right.
But this is way beyond that.
I think we have to but I would divide the blame, not just the executives at HCA, but I would put some of the blame on the insurance companies, even Medicare,
Yeah.
CMS, Medicare, Medicaid services, because if they trusted the doctor's opinion and they allowed the doctor to practice what they were trained to do, some of this stuff wouldn't happen.
Yeah.
The way insurance reimbursement works, it's so crazy. Basically, when you're in network, and this is why I refuse to be in any network, is because they give you a contract. In the contract, it says, oh, this is the only time you're allowed to order an x-ray. This is the only time you're allowed to order an MRI. This is the only time you're allowed to do this service or that service. Well, what am I? Am I a doctor or am I a technician?
Right, because
anybody could do that.
What this ends up creating, and this is where it's problematic, is then doctors either we end up underdiagnosing, right? Because we can't run the tests that we need to actually figure out what's going on.
Yeah.
Or we release prematurely, right? Like it creates all of these things, or you make a doctor have to
the only reason
risk their integrity to get the patient what they need.
This article talked about dangerous premature release from hospitals. We talked about someone we know who had surgery, invasive surgery, got released same day.
Crazy.
So he has to recover at home.
Right.
It's so risky. It's so terrible. It's so scary. And same surgery, they would have kept him 3 nights.
Yeah.
Minimum 3 nights, they would have kept him. The only reason, I promise you, the only reason they released him same day is because insurance said we won't reimburse a second and third night of hospital stay.
Yeah. And this was a person who was going in for a robotic, right? Which then could have been, it was less invasive.
It was supposed to be a robotic laparoscopic surgery.
They pushed the time so many times.
Yeah. And it's probably because they overbooked themselves.
100%.
They overbooked themselves on surgeries. The one surgery runs late. The next one runs a little late. Now this person who's diabetic, who's fasting, his blood sugar tanks and it becomes an emergency surgery. And they go, now we can't do the robotic laparoscopic surgery.
And they send him home like 5 hours later.
Cut him open. So they slice him open. They do the surgery. They sew him up and say, go home. Ridiculous. And I guarantee that's all because of insurance regulations. This is why, I'm not telling you to do this.
Or hospital regulations.
Or hospital regulation. But this is why our family, we never go to a doctor that takes our insurance.
I know. And
we just don't.
People think it's weird.
They think it's weird. They think, we must be made of money. No. The reason we do it is not because we have too much money. It's because we value our health more than our money.
Yeah.
And we may borrow, we'll use our deductible, we'll use our health savings account. But when we call the doctor that we need, we'll say, do you take my insurance? If they say yes, we're like, thank you very much. We're going somewhere else.
Yeah.
Because I want my doctor to be my doctor, not be owned. And I'm going to say this offends a lot of doctors who are in network with insurance companies. They are owned.
Yep.
They are owned. They're incentivized to prescribe certain drugs and not others. They're incentivized to prescribe certain treatments, not others. And insurance companies literally threaten them. They say, hey, you ordered too many MRIs last month. If you do this again, we'll kick you out of the network.
Yeah.
They get threatened.
And for a medical doctor, that is huge,
Yeah.
right? Because that's often where they get their referrals. So, this is one of the reasons why we don't take insurance, because it's such a big thing for us, integrity wise. We know what a doctor needs to do in order to make ends meet being in insurance. You cannot, like, as a chiropractor, the way they cut the fees is so astronomical,
Right.
that we couldn't even keep our lights on.
So what happened is, in the 90s, HMOs became a thing.
Yeah.
And I believe Miss Hillary Clinton had a lot to do with pushing that, and created these HMOs, health management organizations. And these HMOs told the doctors, hey, we'll send you more patients if you be a provider in this HMO. But what they didn't tell them was, we're going to cut your fees by 60, 70%.
Right.
And so the doctors who would see 10 patients in a day and spend 30 minutes with each of those patients are now seeing 40 patients in a day and spending less than 10 minutes with each patient, because they have to make the same amount, because their reimbursements are being cut. Not only that, they're handcuffed.
Yeah.
They can't order certain tests. They can't do certain procedures or medical treatments. It's awful. It's ridiculous.
Yeah.
It's a house of cards, and it's going down. Meanwhile, the insurance companies are making tons more profit than even hospitals like HCA.
Yeah.
Go ahead.
Now, I was just going to say, talking about money, it come to find out the HCA's executives were actually being incentivized.
Mm-hmm.
And, I am one, set goals and KPIs for your business. You have to do that in business. You have to track things. But although they say here in the article, there's no direct evidence that HCA's palliative and hospice care push was intended to increase executive pays, but it in fact did just that. So whether or not that was the intention, it doesn't mean that they are not liking the intended consequences of those pushes, because check this out. Over the 2 years, the HCA's board has used mortality rates to calculate incentive pay. Samuel Hazen, their chief executive, received... I'm trying not to choke when I say this number. The chief executive received $35.3 million in total compensation as an executive. Now, I understand it's a big organization. There's a lot of stress. I get that. That's a lot of flipping money. That's a lot of money.
Yeah, and if they're saving lives, they deserve 10 times more than that. But if they're sending people to die unnecessarily,
correct.
Shame on them.
Correct. It says that 305,000 and some change of that was directly correlated to incentive pay generated by the mortality rate calculation. That's a lot. That's a lot.
I also know there are the president of every medical school sits on the board of pharmaceutical companies. And they also make, on average, $330,000 annually to sit in an hour-long meeting 4 times a year. So they work once a quarter, 4 hours a year, and get $300,000 from Big Pharma. And why would that be? Is probably because the Big Pharma wants to have influence on the education that's delivered to medical students who are our future doctors.
Right.
So you follow the money trail, you see a lot of things. Can I bring it back around to one thing? What does it mean to you? Because part of our focus, why we do this, is to help you.
Right.
Right? So this information, how do you apply it? I would say it's not that you avoid HCA hospitals. In fact, last year they won an award for being one of the most ethical companies in the world. Or it might have been this year. So when I was just doing some research, I saw that. So apparently they're not all bad.
Right.
They do save a lot of lives.
Right.
Right. So if you're in a hospital, you're about to be admitted into a hospital, it's an HCA hospital, don't refuse.
Right.
Go ahead and go. Now, if you or your loved one is being told, hey, we think you should go to hospice, or we should send your parents to hospice, and you feel like, no, there's a chance they'll recover, say no.
Yeah.
Don't Don't blindly follow their advice. Get a second opinion.
100%.
Bring a doctor outside of the system and say, hey, will you look at my mother and tell me if she should be in hospice or not?
Right.
Pay them. It's worth it. What if she recovers? Like Miss Perez there.
Yeah.
What if she recovers?
It's all about questions, right? Because
Yeah.
I think, especially, I feel like since COVID, we as a society have opted to just put our health in someone else's hands, and we don't ask nearly enough questions. And we all know that you are going to get two sides of the coin, and people can argue and debate very well on both sides. We have a lot of data that's out there. You need to ask questions. Like, be willing to ask the hard questions.
Absolutely.
And don't worry if you're asking a question to somebody who thinks you shouldn't be asking it. If anyone says you shouldn't be asking that, or they won't give you the answer,
your
you're
life.
in the wrong place.
That's true. It's your life. I want to say this as a doctor myself. I want to tell you, doctors work for patients. They're not your boss. They're your employee. Your doctors work for you, not the other way around. So they don't get to order you around. They get to recommend what they believe is best in your best interest, and you have a choice. And you can hire a doctor and you can fire your doctor. You're the boss. I have some more data. You just mentioned data.
Yeah.
I pulled up an article. This article is not new. It's from 2018. It was published by CNBC. The title says the third leading cause of death in U.S. most doctors don't want you to know about. A recent Johns Hopkins study. Johns Hopkins is a reputable source.
Yeah.
A recent Johns Hopkins study claims more than 250,000 people in the U.S. die every year from medical errors. Other reports claim the number to be as high as 440,000 annually. 440. If anything caused death to 440,000 people in 1 year, they would shut it down. If it does it year over year over year,
right,
they call it the healthcare system. And the reason there's a discrepancy is because the CDC goes by death certificate, and a lot of times the coroners don't write that it was a medical error. And this is medical errors are the third leading cause of death after heart disease and cancer. So heart disease, cancer, then medicine is what's killing people. Advocates are fighting back, pushing for greater legislation for patient safety. This article talked about this little girl. Her name is Emily, cute 2-year-old. Breaks my heart. It says Emily Jerry was 2 years old when she lost her life after a pharmacy technician filled her intravenous bag with more than 20 times the recommended dose of sodium chloride. So here's someone who's doesn't have a life-threatening condition, but they gave her 20 times the dose of the drug, and it killed her. 2 years old. She's an adorable little girl.
Oh gosh, that's heartbreaking.
Be careful and watch what's going on. Question things. Do your own research. I always say be your own healthcare provider.
Yeah.
Have a team of experts, advisors.
There's too much knowledge at our fingertips now, and sometimes it's too much knowledge, right? So I'm not advocating for people to go on WebMD and go and self-diagnose, right? That's a problem. But there's plenty of information. You can at least figure out what questions you should be asking your doctors or your healthcare team. Ask the questions. Weigh out the answers. If you are not able to process the information being given to you, bring somebody with you. We advocate, even in our office, we want our patients to bring a second set of ears. We give a lot of information to our patients, especially at the beginning of their care, so they are fully aware of what we're seeing, what we're finding, and how we intend to help them move forward and fix the problems that they're walking in with, right? We want them to advocate for themselves. We want them to make an informed decision. So we give a lot of information, and we tell them, bring someone with you. We're going to give you tons of info. our doctors need to be doing more of that. Hey, bring somebody with you who understands, or who can help make a good decision, or who can be a second set of ears, because we're going to be talking about stuff you may not understand. So give patients the opportunity, doctors, give patients the opportunity to advocate for themselves.
Yeah.
Can we say that? It's not just about the patients. Like, doctors, give the patient an opportunity.
Yeah, and unfortunately, some of them can't, because they can't spend more than 3 minutes with that patient, because they need to jump to the next room, because the hospital says you spent too much time with that patient and there's all these patients waiting. You have a quota. You need to see this many patient interactions per day or you don't make your bonus, and all of that. So the problems are too deep and too far and too much. And you know, obviously we're not going to solve the problem here, but hopefully we gave you some stuff that you can use and you can benefit from. And please, if this is useful and helpful information to you, share it, like the video, subscribe to this channel, and tell people about this podcast. We're going to go through more articles. We had a ton that we were going to talk about.
I knew this would be a big one,
but I think this one was worth spending the time on and going deep into. And anyways, I appreciate you listening, and we'll be back soon. Good show.
Great show. Thanks so much.
Thank you.
See you next time.